As she said, my name's Tammy Herrera. I'm a nurse at Mercy in the emergency room there. I work full-time there. There are 4 of us who are specially trained as sexual assault nurse examiners. The state of Kansas does not mandate that you have special training to collect a sexual assault evidence kit. However, we do have specialized programs, and those of us who take it upon ourselves to get that extra training are able to do that. Most county attorneys, police departments, and things like that, if there is a Sane Start program that they have access to, they're going to use that just because we have the specialty equipment and things like that. I'm going to talk to you today about the kit collection itself. What happens when a victim actually presents to the emergency room? It has to be within the last 72 hours. 72 hours is our exposure window to find DNA. Evidence collection isn't always easy. Children, we can do long-term exams on, but it's not if my child comes to me and tells me something happened and it's midnight, I take them right to the hospital. That's not how it works. Children, they're scheduled exams. You would be looking for healed trauma and things like that. But adult-wise, we don't do long-term exams for evidence collection. It's only within the last 72 hours of exposure that they would need the medical exam.
Tammy?
Yes.
Is that how long it takes for the drugs to wear out, or is that a similar window?
Unfortunately, drug-facilitated rapes normally are smaller windows. There are so many drugs out there, and there are so many different half-lives and peaks and when we would find them and when we wouldn't. I believe that GHB and Rohypnol are quickly out of your system. I want to say it's within 6 hours.
Sometimes on some of them they say 2 hours.
Yeah.
From the system in 2 hours.
It depends on, everyone's everyone's metabolism is different. You process things quicker or slower. How much did they drink? How much are they peeing? If they're drinking a lot of caffeine or a lot of beer and they're using the bathroom a lot, it could be out of their system faster. It depends on what it is. They say, well, can't you find it in my hair? Well, not necessarily. If it's a repeated exposure, KBI might be able to do that. At the hospital, we don't actually test for those drugs. We can, but it's much more efficient to send a blood and urine sample to KBI with the kit because they have much more advanced technology and testing for those things, and they can test for a lot more. We're very limited in what we can test for. So, but I can tell you, I don't know of any case that we've actually gotten back that had a positive reading or a positive date rape or any kind of drugs in their system that we didn't already know about. Some people come in admitting to alcohol and drugs. We expect to find some of that stuff, but that stuff is very hard to find, and it is very, very quick to be eliminated from your system. So, and this just kind of talks about what we are as sexual assault nurse examiners. We take a 40-hour class. After that 40-hour class, you have to be a registered nurse to take. Other people can take that class, but you have to be a registered nurse to practice as a nurse examiner. You have a preceptorship where you follow another sane nurse for so many cases. You'll take call time with her. You follow her for those cases. Probably the first 5 you're going to watch. You might assist on the next 5 or so. And then when you're comfortable and the preceptor feels like you are knowledgeable enough to perform your own, you are observed by that preceptor probably for 3 to 5 cases, just depending on how things are going, how quickly you're picking things up, etc. Right now at Mercy, like I said, we have 4. Stephanie is our director, and she is kind of the veteran in this field for us, for our program. We service all of the surrounding counties. Geary County, Marshall County. I can't even tell you how many counties we service. Clay County. There's just not a lot of resources out there to fund Sane Start programs. We've seen children from Nebraska. We've seen, and it's one thing to do adult cases and another thing to do pediatric cases. The pediatric part of it, we actually take a separate course to be able to acutely, if the last exposure was within the last 72 hours, we can always look for DNA no matter what age. But if you're looking for long-term effects and healed trauma on a child, that's a whole separate thing. So, You do have to attend continuing education classes, not only to keep up on new technology and new techniques and things like that, but also to make sure that you have all of the current knowledge on what the current laws are. July 1st, they passed a law that you are able to report or actually make an anonymous report. You're not sure you want to prosecute right now, but obviously you have up to 5 years. Obviously in 5 years that evidence is not going to be there. So if you're within that 72-hour window, you can have that kit collected and that evidence preserved, and it's sent to KBI assigned a number. So there's no identifying markers, no name, birthday, or anything on the outside of that kit, just a number. And so if the victim in 5 years or within that 5-year time frame wants to prosecute and has changed her mind or is now comfortable enough to prosecute, the county where it happened, she would go to the police department there and say, I had this anonymous kit collected, and that's how they would be able to find that kit. It's assigned a number, and the hospital keeps those records. And I'm not sure if we send those numbers to the county as well. I'm not sure. But I know that at the hospital, we keep those records, and they do. They have up to 5 years, yes.
They used to tell you not to shower. Does that matter within the 72 hours? Or?
You know, it doesn't. I mean, of course, if we want to get the best, we would say, no, don't take a shower. But if they've already taken a shower, yeah, we still, I had one victim who came in. She was right at that 72, maybe 74-hour mark. And we collected the kit anyway, and she had 2 showers, been going about her normal daily life, and we actually had positive DNA orally, anally, and vaginally. So you never know. I mean, you never know. It's always, I say, worth a shot.
Yeah, I'd say we'd still prefer that they come in before they...
Sure. That's always better if they come in before. If you have someone who wants to make a report, and they say, well, I'm going to stop and do this first, or let me go change my clothes. And it's hard because we want them to have control, but that evidence is crucial. If they still have the clothes on from that attack, I want those clothes. I want to be able to collect those. If they've changed, but they're going to report, a lot of times the police department or whatever law enforcement agency is involved, they will collect the clothes from the house. So it's kind of, it's, if you have that knowledge to tell them, well, they really are interested in that, or they may be able to get some evidence from that, so let's not do that yet, and things like that. Just kind of talking them through that and making them comfortable with it is important. We have, as you've kind of gotten from today's presentation, law enforcement, advocacy, medical, and prosecute, everything, every department or every professional team is kind of on that Flint Hills Sexual Assault Coalition, and we all kind of have that sexual assault response team training.